Hey students, Professor Melanie here. I thought that one of the easiest ways that I could show you more about the research design and coming up with your clinical research question is just to talk about my dissertation. So I'm going to show you this is what, when you do your dissertation, you have to first explain what you want to do, and then you have to get approval for that project and for that research to take place. So this is what this particular presentation is based on. It's my dissertation proposal defense. It's not my final dissertation. So what I wanted to know is if a single mindfulness and creativity training could impact nursing student stress. And this was an explanatory, sequential, mixed method studies. Now, as you get into your methodology and your research design, you are not going to get anywhere near in depth as this, but I wanted to kind of go through the process and show you how you could see how this all comes to be based on what we're doing with our mini research proposal project that we're doing in the course. So as you can see, I have a table of contents. You don't need a table of contents. I just want to show you kind of what is just like writing a paper. You have your introduction, you have your problem statement, the purpose and significance of the research questions, my stance and experiential base, what we call assumptions, limitations, and delimitations, which you don't have to worry about those. A review of the literature is extensive, and obviously a dissertation and a research proposal, and then the research design, the site, the population and sample, how I would be recruiting, research methods, etc., and ethical considerations and references. So this is, a lot of this is what we're going to be doing, some of this in our mini presentation, but I wanted to kind of show you what this could look like. So we'll move on to the next slide. So just like you will be doing in your paper when you introduce your problem, you will be sharing research. So what I wanted to talk about in my defense, of course, I wanted to do this discussion about nursing students. So I have to introduce that nursing students experience high levels of stress. So I had to explain, they have higher levels of stress typically than our non-nursing peers, right? You've all been to nursing school. It's a lot different than, we have a clinical and a didactic component simultaneously. So we know that everyone in nursing school is experiencing different types of stress. Not only are we experiencing our particular didactic learning about anatomy, H&P, med-surg, all of that's happening while we're learning clinicals. So this was just a most recent study that I was using for my defense, was that of 1,163 nursing students that were surveyed, you can see that 10% were experiencing extremely severe stress and 22% were experiencing severe stress. So that is, a third of the students were sharing that they were extremely or severely stressed. And so, as we know, nursing student training on coping skills for stress is really lacking and not included in formal curricula. Although it is getting better in areas, it is not something that is made up of our component of our courses, right? So this was something I really wanted to use in my introduction, was to drive home the problem that was happening. And then, of course, it went on and on. So that's why in your intro and where you come up with your research question or your research problem, you want to make sure that you have supporting documentation, because that's what's setting the tone and saying, yes, this is an important research project to do. We don't do research just to do it. We do it because we want to solve a problem. And so the problem statement, as you can see, this is all, of course, just minimalized for my presentation that I did. Stress is a significant issue for nursing students. We know that nursing schools are in the early stages of integrating stress coping skills, but, we're not fully there yet. And mindfulness is an essential strategy for reducing nursing student stress. However, could combining mindfulness with creativity training offer further benefits? There's a gap in the literature. So this was my problem statement that I was trying to explain why my research was going to be important. And then the purpose of the study here, does mindfulness and creativity training impact undergraduate nursing student stress? So that was my overall research question. Basically, the purpose was the purpose of my study. And so you can see the significance, high student stress levels impact is impacted by, and it affects other things. So I just explained that in my research presentation. And here were my research questions. Now, you are not going to have all of these questions in your research question. You're going to use the PICO format, but this just goes to show you that thinking about the design of your project has to mimic, like, answer your actual research questions. So in question number 1, you can see that I wrote, does a single mindfulness and creativity training impact nursing student stress in the context of mindfulness and creativity? So is there a significant relationship, and what are the significant differences? Now, when you think about this research question, again, this is getting very deep in the weeds here, but how would we know if mindfulness and creativity training impacts nursing student stress? And how would we know about relationships and differences? We would have to do a quantitative study, right? We're going to look at before and after. So this would be a quantitative component of the study. And then this question number 2, for students who complete a mindfulness and creativity training via an open access online course, do they think that mindfulness and creativity impacted their stress levels? So that is a qualitative question. So those 2 questions and the components of them, the subcomponents, that is why I used a mixed method research methodology, right? I needed to answer a quantitative and a qualitative question within that. So that is why mine was mixed methods. Now, if you just wanted to know, for students who completed a mindfulness and creativity training via the course, what do they think about their, did it impact their stress levels? If you only want to answer one question, then you would do just only a qualitative study. So as you think about your question for your mini research project that we're going to do, and what you want to answer, you want to make sure that you are using the right type of methodology. So if you want to do a case study on how young African American women experience childbirth and what their perceptions are of that lived experience, then you would do a qualitative, right? You're asking their perceptions of how they lived in that experience. If you want to say, I gave, an educational training on how well nursing students scrub the hub, before and after a training, then you would do a pre-test and a post-test, and that's more of a quantitative because you're looking and measuring something. So that's where this methodology comes in, is important to your research question. So as you go through and answer these components and work on these, you're going to use other examples of research to help you come up with an answer, right? You're going to look at quantitative studies and see what they did. When we think of quantitative, we think of, that randomized control study that, we use in pharmacology, right? We had somebody who had a pain level. We measured the pain level before and after we gave a medication, etc. So that's measuring something specific. But if we want to know what students thought about a particular experience at a health fair, right? Or how the health fair impacted them. So those are things that are more qualitative because we're looking for, people's perceptions and lived experiences. So that's why I wanted to kind of show you this information through my project, because I know it so well that I could explain to you why I chose what I did and what I used. So now again, this is very in-depth, but I had to review the literature, and I had several streams and several pages of research that I reviewed and summarized and analyzed. So and I based it on nursing students and stress. So I had to look up the research on, what type of stress nursing students had. I have to look up information on what is mindfulness and mindfulness interventions for nursing students. And I also had to look up creativity. So this was in-depth and thorough. So when you do your project, it's going to be much simpler, and you're going to have research to back up, what is important for you. And then this was my methodology. So I think that this kind of will help you understand how I did my research design. It was, again, a mixed methods design. So phase 1 was pre-training. They did some surveys on stress levels and anxiety, etc. And then I gathered some demographic information. So they did perceived stress scale, they did a creativity and a mindfulness assessment. And then intervention of the quantitative approach was that they did a training course, and it included mindfulness and creativity. And then they did a phase 1 post-training survey and course evaluation. And then I did a quantitative analysis on all of that. So that was my research design. So if you want to look and see in your research design whether something helped with you look at a pre-training, you do an intervention and a post-training, that's going to be a research design of a quantitative. However, I took mine a step further, and I also did interviews that were semi-structured and a focus group to bring that into those trainings together so that I could analyze them all and get results from all of them. So that's why it was mixed methods. So if you just want to say, how do students perceive their first clinical experience, or whatever it is that you're looking at as your PICO question, then you would just do some interviews or a focus group, and then you would analyze them and you would get results. And we're obviously not going to analyze them. We're just talking about how we would think about designing the research. So I hope that this kind of gave you a little bit more understanding of how we go through choosing the research design, because as you can see, this phase 2 answered my second research question, and it also helped answer a little bit with the first research question, but this component here with the pre and post training helped answer my first research question. So you're only going to have a PICO question, and you're not going to have this much in depth, but I wanted you to kind of see how you kind of get to your research design based off of your questions that you're asking. And then we're not getting into this in our particular course, but you can see that this is the research site then. This is the population and sample, and then I chose a convenience sample, and then you can see that I had some recruitment phases, so you can really get more in-depth and in-depth. So your mini research study is going to be far less involved in this, but I just wanted you to understand the full process of how research gets done at the nursing level. Again, this was the different phases. Phase 1 was surveys and intervention. Phase 2 were the interviews and focus group. And then, ethical considerations, we always want to consider the Belmont Report for autonomy, respect for persons, beneficence, justice, confidentiality, informed consent, etc. Because, you're doing a research project on a human, so you have to really remember to address all of these components. And then the other thing was, we were talking about stress and stressors, so that I needed to make sure that I had resources for the students through the counseling center. It was an ethical consideration that I considered, because I was going to be asking them some questions that may have brought up, something for them that may have been, they needed support for. So those were some ethical considerations. And then you could see there's a timeline involved, etc. And then I did have my references. It's not the greatest and easiest to read in Canva, but you can see all of these different references. So, you should have, if you're talking about a problem, you should have, a lot of research behind the problem that you want to discuss. So we only require 3 of your literature review, 3 references for your literature review that you're doing in the paper, but you probably should have at least 7 to 10 references to describe your problem, to support why you're choosing the type of research design that you're choosing and whatnot. So if you have any questions about this, please reach out. But hopefully this kind of gives you an idea of, this is a larger scale research design, but I wanted to help you understand how the research questions help you get to the design, and how they help you look at the ethical considerations and the importance of doing a really good literature review. Now, this was just abbreviated for my particular proposal defense, dissertation proposal defense presentation, but my actual dissertation had several pages, probably at least 10 pages of references overall. So I am going to post my dissertation link in the course so that you can actually just kind of see how long and in depth and whatnot it is. So if you have any questions about any of these research components in the final project, please reach out. But I just wanted to kind of give you an understanding of how we go through and look at this. Again, you're going to have the PICO statement as your research question that you're going to answer, but it will be similar in how you look at your design.